I've always been self-conscious about my under eyes, so I'm here today to get them sorted, hopefully. I am very well practiced at putting makeup on. So yeah, I just put a bit of concealer under my eyes and powder. It's something that's been genetically inherited. My dad has always worn sunglasses inside since I was little, and it's something that I've started doing as well, so I'd like to stop doing that. From the procedure, I'm hoping just to look more fresh when I wake up in the morning, just like a little bit rejuvenated and not look tired all the time.
It's absolutely essential to maintain an aseptic field throughout the procedure, and that means that everything has to be sterile. I think for the medical practitioners, I think that's something that's very obvious, but for anybody who may not be used to it, it's essential that either iodine or chlorhexidine is used to clean the skin. There are many commensal organisms that grow in the skin, even on clean skin, and it is absolutely essential to have that cleaned properly. To get quite wide and broad coverage, so that we have a good field to work from, that's going to be free of any potential sources of infection. Right, I'm going to go through my tangent technique for treating the tear troughs, and essentially what we need to do is deconstruct the tear trough hollow into linear components, because it's quite a complex contour to actually treat. And to do that, just by way of illustration, I'm going to just demonstrate the first tangent. If you think of the tear trough as a sort of semicircle, there's an initial tangent running here, and I'm going to put just some marks on there. And then we have our second tangent, which runs here. And again, this is going to be different for every patient. And for Sarah here, there's not much hollowing on this side, but you may also put in a third tangent over here. I don't think that's going to be necessary in this particular case. Very important to remember that we're not trying to eliminate every single contour. It's normal to have dips and grooves. If you try and eliminate all of them, it creates a very unnatural appearance. Okay, so we want to maintain a natural appearance. A few grooves and dips are not a problem, okay, but what we don't want is a uniform convexity. It's absolutely essential to use a cannula technique. Okay, we want to create the puncture sites distal from where the action is, distant from the tear trough itself, so that if there are any problems, any inflammation, any swelling, any bruising, it's not going to distort the contours. And of course, it's essential to use a cannula because the blood vessels and the vascular networks here are very, very delicate, and the cannula decreases the trauma and reduces the risk of potentially serious complications. Okay. So look up at the ceiling for me, and you're going to feel a sharp scratch. Well done. Okay, we're inducing the cannula along that first tangent, and the filler has, of course, this filler has an anaesthetic in it, so as the filler starts to go in, it will feel more and more easy. Sarah, how are you feeling?
Yeah, okay.
It's not too bad.
No.
And again, I'm injecting in multiple planes. Okay, and that's our first tangent, which is filled. We're going to move on to the second tangent now. Again, using the cannula technique. And again, very gently, very, very small injection aliquots, and always injecting when we're drawing. And just a little massage there. And I'd like you to turn to your right ever so slightly.
Mhm.
Okay, we're going to move on to the third tangent now. Now, there is a very dense network of veins in the lateral calval area. It's essential you examine the skin very carefully to avoid them. And there we go. Now, this is a bit more prickly. Okay, well done. And because we're running through the orbitomalar ligament at this point, the tissue is much tougher. It's important to warn the patient that it can be a lot more prickly. And again, small doses, injected in multiple planes. And there we are. So we've addressed all 3 tangents through 3 little needle points to get a lovely result. Okay, right, come sit forward now.
Mhm.
So we're going to do the second eye now, and again we're going to think of the tear trough as a semicircle. We're going to describe tangents to break it down into linear components. Okay. And I've developed this sort of technique of thinking about the tear trough just to make it really straightforward for people who find these challenging to be able to approach them in a safe and effective manner. So again, it's our second tangent. And then tangent number 3. Chin up for me a little bit. Yes, thank you. Okay, so I'm going to go along that line initially. Well done, not even wincing.
Trying.
And again, we're injecting very, very small volumes in multiple tissue planes. And always give it just a little bit of massage to make sure that the filler's bedded in, and you can sometimes be under the illusion that it's actually giving more of a contour boost than it does. So it's a tiny bit of massage there just to make sure that it's sitting well. Good. Thank you. And now the second contour. Little scratch again, Sarah. And as before, tiny volumes, very, very small aliquots, very low injection pressure in multiple tissue planes. It just looked very slightly towards the left. Well done. And again, looking out for any veins to avoid sharp scratch. And I'll always estimate the risk of a bruise at something in the region of about 5%. And I think particularly in these sorts of areas, and again, it's a bit tricky, isn't it? Megan, you okay?
Yeah.
Okay. Won't include that bit. It's a bit too much force. Look up at the ceiling.
Mhm.
Okay, the last little bit. Again, very, very small injection doses. Okay, and that should be it for you. it's been a pleasure. Right, now I would imagine you want to have a look at the results.
I would
Have a
love
little
to.
look.
Thank you. It looks so much better, and it still looks natural.
Now there are still some irregularities where the needle marks were,
Mhm.
and they take about a day or two to settle down. So
Yeah.
you'll get a little bit of intermittent swelling, and that's a universal reaction to filler around that area.
Mhm.
But it will settle down over the next few days.
Oh, it looks so good. Thank you. You're the best.